Well, welcome everyone to what is the first substantive meeting of Hampshire's Outbreak Engagement Board. I think I've got that right. And I'd like particularly to welcome Judy Gillow, non-executive member of West Hants CCG. I hope I've got that right, Judy. And just checking whether we have Councillor Ken Rattican with us, the leader of Basingstoke and Dean Council. Let me see if I can see him anywhere.
No, he hasn't joined us yet.
He hasn't joined us yet, okay. And moving on, we've also got a number of officers with us, including the Chief Executive and the Head of Legal Services, as well as the Director of Adult Social Care, and of course are very important at the present time Director, Head of Public Health in Hampshire. Could you let me know if there are any official apologies, Kevin? I know we're expecting Councillor Grajewski to be with us very shortly, but are there any official apologies?
We have apologies from Councillor House and Councillor Stallard as well.
Fine, okay. Declarations of interests. Has anyone got any declarations of interests? Right, moving on rapidly. Minutes of the previous meeting, which was held, if I remember rightly, last month. When was it last held?
14th of July.
14th of July, yes, I've just got that coming in. The minutes of the previous meeting, are you all happy with those minutes? Are they accurate indication of what actually took place on the 14th of July? If they are, I will sign them electronically or sign them in reality at some stage in the future. And if we move straight on, are you all happy with those? Do you want to put your hands up if you're not? Okay, you're obviously all happy with those minutes then, because nobody's put up their hands. And moving on, deputations. Councillor Jackie Porter, the stage is yours.
Thank you. Thank you. Hopefully you're all well this very sunny morning. I appreciate that this is a local engagement and it's about how we work through the next few months and the political implications of that as well. And I'd just like to raise the impact of hunger on education and the mental health of our families. I'd like to raise how we can ensure families not in receipt of free school meals and or potentially isolating can be assured that their food needs are met should there be a second outbreak or after the furlough period has finished. The government has managed the basic needs of adults through the offer of food parcels, but this is not offered to children. In our experience anecdotally, and this has been working with the local CCG on weekly meetings with social prescribers, etc., which has been an excellent initiative. We know that the greatest impact that's been hardest to satisfy is the need to ensure families of, as is in most cases, one adult and more than two children, and to ensure that they're adequately fed. Cabinet members may not know this, but the free school meal system doesn't extend to all families in receipt of universal credit. Families with an income of just £7,600 are not eligible, and this affects their vouchers in the holidays and during any out of school lockdown periods too. So if you have an income of £7,600, which is just over £600 a month, you do not receive any vouchers towards the cost of food if you have more than two children. I also wish to speak about access to education in the home. For the sake of equality, equity and thus inclusion, we must ensure that children entitled to laptops, not just in the school years that we've noted, but in every school year, are provided with good access to the internet too. This may prove to be a longer lasting issue than any of us imagined. I want all children to have access to the excellent education that Hampshire schools can provide. On a local note, of Winchester Cabinet member, I'd just like to say thank you to the NHS and to the CCG who've had regular meetings. It's been really helpful. And I'm hoping that we don't have to impose any local lockdowns over the months to come. Thank you.
Thank you very much, Councillor Porter. And we'll certainly bear your comments in mind in the future as regards the COVID-19 outbreak.
Thank you.
Moving on to my opening remarks, a couple of things I want to say. First of all, something we may well cover later. I think it's important that we have a process that we can call briefings quickly if necessary. And that's separate from our formal meetings that will take place at the moment every month, of which this is the August one. Because clearly events move fast, and I think we need a good system of communication so that the board members and myself can be briefed as to what's going on at a particular part of Hampshire and at a particular time. I won't cover any more of that now because I know the Director of Public Health will be covering this in his comments to the meeting. I'm also keen that we actually ensure that we've got a good system of communication that we can use with all the boroughs and districts, the town councils and the parish councils and other public authorities where it's relevant to do so. And we'll be finding a way of doing that subsequently after this meeting. And the final point I'd make is we have just in the process of issuing a press release, and I will quote a couple of comments from it that I make in it as direct quotes. And this really follows on from what I said way back in March, that the three things we have to do with this outbreak is: one, control the virus; two, work together in order to achieve that, and that means both the public and the private sector; and thirdly, look after each other. More specifically, with this phase of the outbreak, we need to keep Hampshire safe so that we can actually enjoy some of the freedoms that we've got back. Infection rates at the moment are low in the southeast, but the actual circulation of the virus remains a threat, so we mustn't relax. As we move forward, we will refine our plans to reflect best practice and the latest government advice so that we can continue to deal effectively with any further outbreaks. Together, we can protect one another and keep our country safe. And I encourage in the press release everyone in Hampshire to play a part in that. To ensure the public can keep up to date with what's happening across the county, a new web page has been created at www.hants.gov.uk/coronavirus, which includes a number of resources and assets and contains links to the new COVID-19 dashboard. Don't forget, there are a few simple things everyone can do to help keep the virus in check and prevent local lockdowns in our area. Keep your distance from people not in your household or support bubble 2 meters apart wherever possible. Wear face coverings when asked to do so. Wash your hands frequently. You can't do it too often. And if you have symptoms, no matter how mild, get a test. It's quick and easy to do. And you can book it through www.nhs.uk/coronavirus or call the number 119. That is the press release that's about to go out to everybody, but I thought the committee would like the information about it. That concludes my opening remarks. I'm now going to hand over, and we're now on to item 6, substantive part of the meeting. I'm now going to hand over to the Director of Public Health, Simon Bryant.
Many thanks, Judah. And with your permission, I could share a presentation, if that's okay, on the screen, just to talk through some of the data. He says as his system starts to go through. I hope that's visible to everybody. And apologies, as you can understand, board, this data comes out and is updated very regularly. I got this at about 10:30 this morning, updating each week. So what I'll do is share this, and this will be emailed round to the board members today after the board, but on a weekly basis. So you'll have this. And this is the latest situation. So this presentation contains information on infections and cases within Hampshire and the districts and the overall picture. The care home data hasn't come out, but I can share we're in a very good position there, and we've got a number of deaths. So when we look at the epidemic curve, you can see back in the peak in April, we had a high number of cases on a daily rate. So that was 100, you know, we got it to about 140, and we're now down on the right hand side there. And in the last 7 days, we had 14 cases, which is really positive. And we're at a rate of 371 per 100,000 in total. The other rate we look at is the rate per 7 days, and we're down to a rate of 1.2 per 100,000. If I can just put it in context, when Leicester was kind of starting its lockdown, it was at 100 per 100,000. So we're really in a really good position, and I think that's very, very positive. When we look at the districts, this is cumulative over time. So you can see actually when the cases were rising, and you can see now that actually the cases have flattened off. We can see England still going there a little bit, connected to those cases in Leicester and Manchester, but in the southeast and particularly within Hampshire districts, we are in a very good position with occasional cases coming forward in different districts. And we look at that, I look at that with my team on a daily basis to see if there's any connections, any particular concerning settings to make sure that we can manage any situations. And when I talk about the powers, it's worth just highlighting we do this work outside COVID times, managing outbreaks of different diseases. This next slide looks at infections across the country, and you can see Blackburn and Darwin has continued increase and Leicester's decreased. On the left-hand side, you've got the weekly rate, which is the important one, and you can see Hampshire is a lovely blue with also its neighbours. So in the southeast, we're doing very, very well in terms of managing outbreaks and number of cases, which is positive. Kent did have a slight raise this week, but you know, we work with our colleagues to understand what's going on there to see if there'd be any impact on our area. And I'm very pleased with the position we're in, working closely with the Test and Trace programme. And in the southeast, we're working very well with there. You'll have heard a lot of noise about that. However, we have a very, very good, strong relationship with the local Public Health England team and Test and Trace, which is improving all the time, a brand new system. And actually, we are contacting 90% of our contacts in the southeast, which is very positive. It's also worth saying, when I say 90%, if there's one person in the family who is contacted and 3 other contacts are made, they technically haven't talked to those other people, but they're not counted as being contacted. So we're doing incredibly well there. Deaths, it's really important we look at deaths, and we can see in this graph that deaths have continued to decline, and the latest week figure is 2, which is positive, and there have been no excess deaths. And you can see at the height of the pandemic, weeks being weeks in the year, so week 2 is the second week in January and so forth, we have excess deaths at that peak, but now we're come right down and lower than the 5-year average. And we just need to look at that over time to see actually did coronavirus bring some deaths forward, and we're looking at that. So we are working through that. So that's a very quick summary of the data. I'm very happy to take any questions on that as appropriate.
Thank you very much, Simon. A couple of points. First of all, can I just welcome Ken Rattigan and Judith Gajewski, who's joined the meeting. I just got one question. Just remind us how often we will get this information.
So I'll be sending that round on a weekly basis. As I said, sometimes the data gets a little bit delayed due to the complexity. So it's supposed to come out on a Thursday evening, and apologies that I couldn't actually get it round to the board before this morning. You'll be getting it on a weekly basis at the end of the week. And I'll share that in an email with everybody if people are in agreement.
Thank you very much, Simon. That's great. Judith. welcome.
Thank you. Yeah, my Hilliers meeting overran by 5 minutes, so I'm sorry about that. Yeah, Simon.
What were you doing at Hilliers then?
Well, it's one of my outside bodies, the Gardens and Arboretum, but anyway, I'll tell you about that later. On the weekly rate, Simon, the left-hand side one that you've just shown us, the Isle of Wight was a darker blue, and it was too small for me to actually read the numbers. Could you just expand on that a little bit, please?
Very happily. Darker blue means no cases, so that's really positive. So yeah, maybe there's a national map. I can't change the colouring, I'm afraid, because it does look like it's got more, but no, it means 0 cases.
Yeah, thank you.
But obviously that does mean if they have an increase next week, it looks like a massive increase, because 1 from 0 is a well over 100% increase.
You've got to actually, you're absolutely right making that point. With very low numbers, you tend to find the press then use the percentages, which makes it look really bad, which it isn't, of course. Ken, welcome. And you've got a question.
I do. Thank you, Keith, and thank you very much, all of you, for letting me join this, because it's important for our borough, and it's good to have the information to hand and understand what's happening on a local level. My question, Simon, is Basingstoke and Deane seems to be running ahead of the English figures. Is there any reason for that? Is it because of the number of care homes, or the fact we have a hospital, or is there anything particular to that?
Thank you. And Basingstoke has been an interesting place to watch. And I think so. That graph I showed was a cumulative rate. And at the beginning of the pandemic, Hampshire Hospitals was a really a vanguard, and they did a lot of testing early on. So they're one of the first hospitals in the country to do testing. So because they tested more, they found more positives when other hospitals weren't testing. So what actually happened was it was an artifact of the testing data that meant that Basingstoke had a high number of cases. And also at the beginning, we had a couple of larger families who had been to Italy, and they all caught it, unfortunately, and we tested them. And so when you have a family of 6, obviously that is at the beginning, that's quite a large number. So it's an artifact of that data, and we are looking at all districts and all areas, and there's nothing to be concerned about in Basingstoke and Deane. We are aware of the population there as well.
Thank you.
Yeah, I think it's that graph I've always found not misleading, but you've got to look at it pretty closely, because it's not so much where your particular line is what your line's doing. Is it going on increasing, or is it flat? And although, as Simon rightly said, in Basingstoke there was a climb initially, it's almost as flat as the rest. What I think is noticeable is that the English line is actually rising slightly. Judith, you've probably got something much more detailed than that to tell me.
Well, no, but I think it's a point, worth making again. Across Hampshire, there was quite a lot of concern at the start that our numbers appeared to be high. But as Simon has said, it was because we did so much testing earlier on that we identified more cases, and I just think that that needs to be understood. That I guess the more you test, the more cases you're going to find, and as it's panned out, we are now, I think, Simon, correct me if I'm wrong, but we're below the median for our position in the districts.
Yeah, and our rates are really good. And it's also worth saying at the beginning, because it's around half term, we seem to have maybe a disproportionate number of people travelling skiing in half term to Italy, rather other parts of the country seem to manage that in a different way. So there was a few factors there that we just had to understand.
Exactly. Thanks.
I think I'm right in saying the other point's important to have the ratio between the number of tests and the number of positives for the test. Like if you test 100 people and 50 of them are positive, that's pretty serious. If you test 10,000 people and 100 are positive, twice as many as in the first test, that is probably much less significant.
And you're right, Leader. The reason that's really important is because what we want to do is make sure we've got enough testing capacity, because we don't want people not to get tested. and not find out about them. So I'd rather have, and we've now got the ability to direct testing in a much more rapid way to enable that to happen. So if there's any area of concern, and I know that a colleague a little bit further down the coast was slightly concerned about one of their areas, and they quickly put a lot of testing in there to make sure anyone who had any symptoms could get a test really easily, and that's really important, and we'll be doing that if we need to. I haven't had to do that.
Thank you, Simon. If there are no more questions on this item, we can move on to item 7 on our agenda, action of the Department of the Director of Public Health.
So I think if I can start off, due to this board is about kind of the engagement board. As I showed you in the figures, we haven't taken any significant actions or had to. We are monitoring any incidents or outbreaks, and it's worth saying that an outbreak is 2 cases that are connected. And you'll have seen in the news a number of kind of cases over the past month and past week. There was an incident in the pub in Lymington, and also we had the incident in the pub in Gosport. So we're managing those, and those are part of our routine bread and butter work. I guess what coronavirus has done is meant we're doing this at scale and managing that in a kind of more strategic way. So I just wanted to talk to the board a little bit about the new powers, which I think would be helpful. So in terms of the legislative framework, and I've got the head of legal on the meeting, so I'll be very careful, and she'll make sure I don't make any errors. But we've got 4 acts that are key. One is the Public Health Act of 1984. One is the NHS Act of 2006 and Health and Social Care Act of 2012. And then the Coronavirus Act of 2020, and then a number of regulations. And all those come together to enable us to manage the pandemic. So you can see that actually, because some go back to 1984, we've had a number of these powers already, working with our district colleagues as well. The Coronavirus Act legislation is new, so I'll just go through some of those powers now. So that came into force in 2020, 18th of July, and it expires in January 2021. And that gives us the power to make directions in respect of premises, events and public outdoor places. And it's a chief executive decision, and it's a decision may prohibit or require or restrict things. And let me assure district council colleagues, we would not do this without discussion and working with them, because obviously there is a geography there that we need to work with, and we work very closely with the districts on both the local health protection board and in routine business with particularly environmental health colleagues. Furthermore, the Secretary of State may kind of direct county council to get in a way for lockdown, and that's what's happened in more recent times in Manchester. So we've got a number of those regulations. The 3 conditions must be met for us to use those. One is about a serious imminent threat to public health, and I think that's both in terms of the number of cases that we're seeing and they're low, or with very careful consideration that the way that something is going on. So if there was an event that looked like they had very poor social distancing or very poor measures, we could use this to control that. But obviously prior to that, we want to work with the event or the setting to see if we could improve those conditions of social distancing, hand hygiene and those kind of things. So and the requirement needs to be proportionate to meet those purposes, and that's what we'll be doing. So in order to deliver these powers, the county council and the chief executive in this case will have to have regard of myself and regard to the public sector equality duty, and take reasonable steps with advance notice of the direction. And I think reasonable steps is really key, because we'll be working at pace if we need to do this. And of course we want to give notice, and how we do that in a very rapid way, and we'll be reforming this board. So get the relevant agreement if it's an outdoor place, formed part of Crown land. Work with the district councils and our neighbouring authorities, both the unitary councils of Southampton and Portsmouth, but we have many other borders, Surrey, Sussex, etc. Also, we must notify the Secretary of State and review them every 7 days. So I think there's a number of measures we have in place, and those new powers are really important to us to help us manage this. We haven't, you would have known if we had to use them, we haven't had to use them. I know others are considering around the southeast. We're learning very fast from other colleagues in the southeast who are thinking about that for particularly difficult situations they're dealing with. Maybe, yeah, I don't want to embarrass the other direct public health colleagues, but they're considering it where there are concerns about different settings and situations arising. But I'm very comfortable that those powers are really useful. And as I said, I really must emphasise, particularly for those who work with districts, that actually we'll be doing this with you, and we wouldn't impose this on a district area without conversation. I will stop there and again take questions on that or anything else.
Just before I ask Judith to, Barbara, I just wanted to check whether you had anything to add to that at all.
No, Leader. I think that's a very succinct and accurate summary.
Thank you. Judith.
Thank you. Simon, I fully understand why we have these extra powers, and I think it's quite right that we have them. But we have extra powers now, we have guidelines, we have various other things. But what about enforcement? You know, who is enforcing these things? I see people out who are not social distancing. They're from, you know, multiple families, parties going on with dozens of cars parked outside, people not wearing face masks properly, and not social distancing shops. There seems to be very, well, little enforcement at all. Should there be? What's your view on that, please?
So you're right. The powers relate to kind of settings and places, and we can enforce those through our powers, and that's really helpful. I think you're absolutely right. There is a challenge in behaviour change and encouraging people to do things differently that they don't normally do. As you say, social distancing, it's not what we're used to. We're not used to wearing face coverings in shops. We're not used to not connecting with family and friends in the same way, and it is difficult. The police do have powers if need be, and they're very carefully using them because they want to keep their relationship with the public really sound. And so it is really difficult. And I think the paper that's coming up, the comms paper, communications paper, starts to show what we're trying to do to really encourage people. But actually, it's quite difficult to enforce this on an individual basis. And somehow we have a role as a board to kind of model that behaviour and also to encourage that. But it is very, very challenging. I do take that on board.
Thank you.
I think that's quite a good point. I'll come to Ken in a minute, that we on this board need to lead by example. And in a sense, we've had a number of instances across the country where people in positions of authority have obviously thought the rules were for somebody else, not them. And I think it's really important that we don't fall into that trap, even by mistake. Like, I make a point of virtually always wearing my face mask when I get out the car, simply so that I know I've got it with me when I get into a shop. I suppose that's part of my military training, I don't know. But it is a point, I think, that we need to ensure that we lead by example when we can. I think the other point I was going to make to you, Simon, is about the difference between an incident, which obviously the Mayflower pub in Lymington was a case in point, and an outbreak. So when should we actually be talking about outbreaks? What sort of
yes, apologies. It is quite a complex technical term, but it's sometimes quite important. So an outbreak is 2 or more connected cases in a particular place. If you have an incident, that might be 1 case. It may cause a lot of work because we're doing the contact tracing. And if I can just talk about the situation in the pub, I think it's called the Village Pub in Gosport, which was on the news. We had a case there, and we followed up all the people that we through contact tracing, and it went very well. And equally, we watched, and every new case came through. So we may have missed some of those. We checked if they were connected to that pub for 14 days, because you know that's the incubation period. So that was an incident with 1 case, and we followed up. So it didn't become an outbreak. However, it does cause work. And I think from my perspective, if there's an outbreak of significance, so actually not in control, we will be informing the board. If something's in control, then we will get outbreaks. Graham's team deals with outbreaks in nursing homes on a regular basis, not just around coronavirus, because that's the nature of the disease. And we, so we're doing that well. We've supported a number of settings to make sure those workplaces are safe. So an incident we class as one case, an outbreak is 2 or more connected cases.
Thank you, Simon. Ken.
Thank you. Simon, you've mentioned settings and places. I wonder, how does that relate to the boundaries of a local lockdown? If it was a pub, how close to that pub, or how will you be setting boundaries in terms of those local lockdowns?
So I think in terms of, if I can just step back a bit and not talk about local lockdown. So for a setting, it will be a place, a business, an office block or a pub or something like that. If we're moving into local lockdown of a village or something like that, I think that's a different place, and we work that boundary on what works for the local population. So I do understand from the work in Manchester that there was one kind of part of Manchester that had a low number of cases, but actually it worked better to lock down the whole of Manchester. Now that's frustrating for those people who live there. It would be working to work the best geography, but initially it's really about the settings. And I think if we can do that, or it might be a particular park where we're finding people are congregating, back to Councillor Grayevsky's point, actually we might want to close the park down because we can't stop people congregating. We've tried everything else. And I know my colleagues, I'll say carefully, but maybe thinking about beaches, and we need to do so. But for me, it's those particular settings, and we do be very specific about it.
Thank you. That's great.
I'm convinced that one of the ways in which we encourage people to abide by the rules, which Judith mentioned earlier, is to point out that if we can keep any outbreaks as small as possible so that they're just incidents, it minimises inconvenience to everybody. But the larger the problem, the more complicated it is to decide exactly what the boundary of the lockdown area is. Like, I know they had problems in Leicester early on as to how far the villages on the edge of Leicester were included, because in many cases, and particularly this is true in parts of our county, it's difficult to know when one village stops and the other one starts, and where you actually create the boundary. So to avoid those sorts of issues, that's where we really need to encourage everybody to abide by the rules on distancing, wearing face masks, and having tests if they're at all worried about their own health. Okay, if there are no other questions, we'll move straight on to the last item on the agenda, which is I've got it here somewhere, communications and engagement update.
Apologies, committee, you've got me again. So let me just talk through that plan. So we have a comprehensive communication approach for delivering the local outbreak control plan and supporting the important work of this board. It's a collaborative working with our local resilience forum partners, looking at particular audiences, stakeholder groups, schools, businesses, and also the vulnerable and shielded, which are really key areas. And we've taken lessons from our Pathfinder partners in Surrey County Council and Public Health England. So the plan has 2 strands. One is about swift communication and response to an incident and outbreak, which you can imagine that needs to be rapid, and we do that well. And then proactive prevention, amplifying the test and trace messages as well. So the primary objective is to support the outbreak management, and we have a new brand called Keeping Hampshire Safe, and we're working with the district. So there's one called, we've worked with Keeping Basingstoke Safe, so we can work through that. So we're all supporting the government's key lines, which will run through the summer and autumn. And we'll support that by a changing set of weekly communication messages, flexing on the situation, which will include things like, as been mentioned before, focusing on hand washing one week, social distancing another week. And this will focus on those groups that we need to think about, particularly the BAME communities, and those communities more at risk from harm. And then those people who are perhaps not following social distancing as close as we like to, maybe the young people, and then those people who are older, who are more at risk. So we've got a number of work streams that we're overseeing. We've done a lot of work with schools and education at the end of last term and in preparation for this coming term. We've had a number of webinars, I think well over 25, for schools, early years, childcare providers, further education, to help them prepare for this coming September, which is really important we do that. And that's been really, really positively received. And we're producing guidance and flowcharts for them. We've worked with our business community and provided information, particularly those settings we're more concerned about, and we're following the new action cards that have come out for particular business settings, and that's really helpful, and we shared that with the district councils through their connections and also through our county council's economic development team. We had a very strong relationship with our care homes already through the work that Graham was leading, not just in COVID, but during COVID it kind of became more focused on how we communicate the public health messages, and we've got a very good communication protocol there. So in terms of the media handling, if there was an outbreak, we are well prepared to deal with that. We are ready for any outbreak and communication we need to, and we will work with the district council partners, the local NHS and Public Health England to get those messages out quickly, and to support that setting and support the community. And we've had just a little bit of evaluation. We've had really good take up of key messages across all media, and with 92% being positive or neutral from over 700 items of news coverage since the start of the pandemic. So we've done an awful lot of media, and we're not stopping that. So if you could note that update, and that plan will be shared with you in due course. I will take questions there, Leader.
Simon, thank you very much for that. I think it really just re-emphasises the point about all working together, talking to each other about what's going on, provided we know how clear those lines of communication are. And there was a point I was going to make at some stage. You've given us a lot of briefing material. Any of the items that you think are important, make certain they find their way into the minutes of the meeting so that we've got something to refer back to. And if any member of the board wants more information about any of the items that have been mentioned by Simon, let him know directly, or let me know. Any questions for Simon on that last point? Well, are you all happy? You seem to be. It must be the holiday spirit or something. Ah, Judith, just in time. You need to put your microphone on there.
Yes, yeah, I don't know whether it comes under here, or perhaps I should have asked earlier, but Simon, you'll know that I've been asking for if we can produce information in different languages. How's that coming along, please?
We've just now received some of that from the national source, so we have got that, and we are making sure that's I was going to say pushed out. That's communicated to those communities in the right way. We also need to work to make sure that that information is understood, and I know through because the testing information is really important, so we've got that in different languages as well now, so people can understand what that means. Because speaking to someone this morning, if you've had a test, it's not pleasant, and it needs a little bit of thought, so we need to really communicate that very clearly.
Mm-hmm. Thank you.
That is a good point, Judith. Is there one of the languages Nepalese, because that's where we've got a clear concentration of a particular ethnic minority in Aldershot, although a lot of them actually speak English well. Nonetheless, some of the families don't.
I couldn't answer that today, but I'll go and check that out.
Yeah, it might be just worth checking. It's probably worth checking with the chief executive of Aldershot, because I know he's well on top of this issue. Okay, well, if there's nothing else, thank you all very much. At the moment, we've got our next formal meeting on the 17th of September, But as I say, one of the things we've got to do with this particular group is to ensure that we can pull together a meeting quickly for a briefing from Simon if there is anything specifically we need to know about. But I'm confident now that we've got a lot of the mechanisms up and running, which will allow us to deal with hopefully what will be minor incidents rather than major outbreaks, and that we've got the tools that we need in order to deal with it. And I also note some of the comments that have been made by members of the board, particularly in terms of enforcement. And I think that is an issue that we'll obviously have to look at if things start to go wrong at any stage. Anyway, Simon, you just wanted...
I've just found the information in Nepalese while you were talking.
Thank you very much indeed. That's what I call a quick response. Okay, thank you all very much. And we'll meet formally in September, but I'm certain I'll be seeing you online long before that. Thank you.